In this video, we're talking about Donepezil. Donepezil is a drug used for Alzheimer's disease, especially early in the disease process, to help with symptoms of the cognitive symptoms. Not being sharp cognitively is a symptom early on. And the trade name for this drug is Aricept, and it's the most prescribed drug early on in Alzheimer's disease. And again, it doesn't help with the progression, it doesn't slow it down, but it does help temporarily with symptoms where the patient can feel a little bit sharper with their cognitive abilities for a little bit longer. So let's talk about Alzheimer's disease and what's going on in the brain. So I know I'm not the best artist, but let's just try to work with this. So we have a sagittal section of the brain, so we're looking at the right half of the brain. And you have the cerebrum here, the cerebellum, the brainstem, and this is the cerebrum, but it's called the temporal lobe. We have the thalamus here, and the hypothalamus here, and then the pituitary down here. So that gives you a reference. So when you have Alzheimer's disease, eventually there's just whole brain atrophy. So the whole brain gets smaller, but there's two areas that specifically get even more atrophy. And one of these areas is the hippocampus, where our memory center is. And so I have that marked here with the green. It's on the inside of the hippocampus. And you just have a lot of volume loss there. You can see it on MRI. And then you also have neuronal cell death, called neurodegeneration, happen in what's called the basal forebrain nuclei. So if this is the forebrain here, the base of it is here. So these are called basal forebrain nuclei, and it's different clusters of cholinergic neurons. So these are neurons that release acetylcholine as their neurotransmitter. And acetylcholine gets released all through the brain from these neurons. So the axons take them all throughout the brain, they get released, and they help us feel more cognitively alert. It's called acetylcholine transmission. And when you have Alzheimer's disease, early on you get a lot of death of these cells, and they don't produce as much acetylcholine, so you don't get that cholinergic transmission, and you feel like you're just in a constant state of brain fog. We've all been there where you're just worn out, tired, sleep deprived, or right before you go to bed, and your brain just isn't working. So that's how you feel all the time early on with Alzheimer's disease. And if you take Donepezil, this can help prolong that really taking hold. So the biggest of these nuclei is, the biggest cluster is called the nucleus basalis of Maynard. And so that's the one we're focusing on. So you have a lot of cells die in this nucleus. And when we don't have as many neurons supplying acetylcholine, that causes an overall decrease in acetylcholine. So what Donepezil or Aricept does is it tries to get the most out of the cholinergic neurons we do have coming out of this nucleus basalis of Maynard. So to give you an idea, we're going to zoom in here, and right here kind of at the top corner of the hypothalamus is where this nucleus is, just outside of the hypothalamus. So if we're looking from the top down, here's the hypothalamus. We only have one of them. It comes around like an arch here, and you have a right and left hypothalamus. And then here's the third ventricle in between where there's cerebrospinal fluid. But just outside of the hypothalamus, you have the nucleus basalis of Maynard, which supplies acetylcholine throughout the brain and helps us feel cognitively alert. So, a few things. What causes neurodegeneration in the first place? And there's different theories. So I'm just going to kind of give you one theory where there's this beta amyloid plaque that builds up. And beta amyloid plaque builds up outside of the neurons, and it can cause issues inside the neuron where we have tau proteins along the microtubules of our axons. Those tau proteins get hyperphosphorylated, so a lot of phosphates get attached to them, and it causes them to clump up inside the cell, and we call that neurofibrillary tangles. So once that happens, especially in like the hippocampus, you get excitotoxicity. This is where glutamate, the main excitatory neurotransmitter in the brain that's real active in the hippocampus, it'll release a lot of glutamate, which ultimately leads to a lot of calcium inside the cell. When the calcium builds up too much inside the cell, it just dies. And that's excitotoxicity. So that could be happening in any of these two spots and causing that neurodegeneration and atrophy that you can see on an MRI. It's kind of interesting as far as diagnosing Alzheimer's disease. There's a couple of cognitive tests, one being like the mini mental state exam, the Montreal cognitive assessment. These are a couple of exams. If you get a certain score, that can be something to kind of pull into the workup as far as diagnosing this. There's a non-invasive way to see how much beta amyloid plaque you have in the brain, which is a hallmark feature of Alzheimer's disease. And it's using a radioactive tracer called Pittsburgh compound B. And this is non-invasive. You can use it with a PET scan. So positron emission tomography, where you get a good picture of the brain. And you have this radio tracer that goes and attaches specifically to the beta amyloid plaque, and you can see how much someone has. They're using this a lot in studies. So that's some ways of diagnosing it, and just the symptoms. They're having cognitive issues, and so that's might be the first drug that is prescribed as Donepezil, because it's good in the early processes of the disease process. So let's talk about what it does at the molecular level. So we have not as many cholinergic neurons as you normally do, so we want to make the most of it. So as the action potential comes down and goes into the brain, we finally get to the end of the neuron, which is the axon terminal here. And that's where we have vesicles full of acetylcholine that are made up. And then when that action potential hits, calcium influxes in, and that causes exocytosis of the acetylcholine. So it gets released into the synaptic cleft, and it'll bind to acetylcholine receptors. But it's not out there very long. It just kind of is transiently out there, and then you have these little Pac-Man enzymes called acetylcholine esterase that will break them down, and they break them into acetic acid and choline, and then it'll go and reuptake into the presynaptic terminal. But if you inhibit these with Donepezil, which is a acetylcholine esterase inhibitor, there's a couple more used in Alzheimer's disease. One being rivastigmine. Anytime you hear stigmine as a suffix, it's acetylcholine esterase inhibitor. So rivastigmine is one drug, galantamine is another, but by far Donepezil or Aricept is the most commonly prescribed one for this purpose. So if you inhibit that acetylcholine esterase, that acetylcholine is out there in the synapse longer, that's going to give you a stronger effect. So you're going to have more acetylcholine bind to the postsynaptic neuron. It's going to have a stronger effect. So we're getting more bang for our buck. We're getting more out of that cholinergic neuron because we're keeping it out there, marinating in the synaptic cleft longer and causing more interaction with receptors. And so this helps with cognitive abilities and helps them feel a little bit more sharp cognitively, and can kind of stave off that process of feeling that brain fog. So there's other drugs. There's not really good drugs in general for Alzheimer's disease, but at least this one kind of gives you a little bit more time. There's a lot of failures. There's another whole class of drugs. Memantine is the main drug in that class that deals with the excitotoxicity, and so that's a whole different drug, but just wanted to let you know a little bit about Donepezil.